I'm just going to give a short presentation about an example project that I'm involved in. But I'm going to just start by setting the scene by reminding you all that we are heading for a situation in which all of us are failing to die with our first disease. And so instead of dying, we live on and get the second and the third and the fourth. And therefore, all of us as a population are increasing the complexity and the volume of healthcare needs that need to be addressed. And our survival strategy for that as health systems has to involve at least a couple of very important things. One is that we've got to bring patients much more strongly into the care environment. I'm not talking about just their data, I'm talking about their activity, their passion, their commitment, and their willingness to be co-creators of health. And secondly, we've got to make sure our health systems really use the data we have to deliver the best possible care they can, the best possible outcomes they can. Now, on this slide, you see an explosion of many different things that we do today already. These are, if you like, the old-fashioned things. We offer patients portals and apps, and they can do most of these kinds of things if we look after them well and we coach them well. I'm not saying everybody on the planet has this experience, but we know how to do this. And already in this session, we've been discussing that if we engage people in a positive way about how their data can be used and safeguarded appropriately, they're willing for their data, Sarah's green zone on her first chart, but also to allow their black zone, the professional data, to be used for research. But the word that you don't see on this slide is outcomes. And I want to highlight outcomes as my topic for the next 3 or so minutes. We still under-collect health outcomes from our patients, and therefore we are missing an important steer for how to optimize those outcomes and deliver the best value healthcare to all. So the IMI project H2O is the one I'd like to just show you 2 or 3 slides about. And it's a project that's just a year into its 5-year mission, which is to help enable patients to collect outcomes at scale. And this is probably the master slide of the project. It's a little bit busy, but I'd like you to start by reading it from the right. And probably if I was drawing it, I might have drawn it the other way around. H2O is going to equip patients in 4 countries in 3 disease areas: diabetes, inflammatory bowel disease, and a cancer, yet to be determined which ones, with apps that will allow them to collect health outcomes. And the health outcomes to be collected are currently being designed and developed through Delphi surveys. We'll fuse that outcome data with their hospital electronic health record data and any other supplementary data sources only with consent, and offer back to the patients that holistic view of their outcomes. And provided they consent, it's shared with their clinician so that they are able to make better joint decisions about how to optimize a care pathway, get the best possible outcomes. And then on the left of the slide, anonymized, aggregated data used within a country at a national level and also at a European level for learning about outcomes. So this is, you could consider this to be a tech project. Develop apps, give them, train people, collect data, build architectures, apply data protection. But it's really importantly a culture change project. It's about helping to create learning communities that are hungry to understand outcomes and actually want to learn from those outcomes how they can improve patient care at the micro level for one person and at the macro level for whole regions, countries, and at a European level. So just my last slide for a few seconds only. To return to the topic of this session, we want patients to be the top beneficiary because they will have a richer dialogue with their clinicians about outcomes. And of course, the health professionals will be empowered with more outcomes data. But we want other actors, and the next few are just examples, Patient organizations can use outcomes data to help understand where there are unmet needs. People who are driving the health system can drive it towards better outcomes. And of course, the research community can better target innovations towards improving outcomes for all. So thanks very much, Sarah. That's really the story I wanted to tell. It raises loads of questions and issues, and I'm sure our very chatty audience will put things in the chat. Thank you.